Yeah, we can introduce ourselves. Good morning, good afternoon. My name is Vivian Brady-Phillips, Deputy Mayor of Jersey City, New Jersey, and I'm here filling in for Mayor Stephen Phillips, who wasn't able to join us this afternoon. And I'm really pleased to stand here with Analilia Mejia, Political Director of Working Families and previously of 32BJ SEIU, and talk about the partnership that brought forth Jersey City's paid sick leave ordinance back in September. So a little bit about Jersey City. We are a city of a little more than 250,000 people, and we are actually the second largest city and poised to become the largest city in New Jersey. They say by 2016. That's the word on the street. And we are the first municipality in New Jersey to adopt mandatory paid sick leave, and the sixth municipality in the nation. There's also the state of Connecticut to pass paid sick leave, and we're really pleased as a city to tell this wonderful group about our efforts to be at the forefront of what is a growing national discussion about the need for paid sick leave. So I'll tell you just a little bit about the ordinance. We've got about 30,000 private sector workers, and this ordinance was adopted, and it really helps us address some great community needs. It helps us support vulnerable populations, working families, working mothers, caregivers, lower income employees in the private sector who are less likely to have access to paid sick time. We're also very motivated by the health implications of paid sick leave. It enables us to protect community health. It makes sure that food service workers are not compelled to go to work when they're ill, which puts them and the rest of the community at risk. It allows working parents to stay home and care for children when they are sick without being worried about losing employment. It also helps ensure that people can have access to preventive care and seek that out, and actually have an opportunity and a way to take care of themselves. And we think that helps strengthen the community and particularly families. And we also think that it strengthens the local economy. So for all of these reasons, we pursued paid sick leave. And as the mayor and community organizers mentioned, this didn't happen just because of the mayor and the administration. This was a community effort and a broad coalition of community groups and their efforts to make this happen. So just a little bit about the key provisions of the ordinance. It applies to businesses with 10 or more employees, and notice provisions, and it kicks in after 90 days, and it applies to employees who work 80 hours a year. And for those who are employed in companies that have fewer than 10 employees, they now have access to unpaid sick leave. So in addition to that, we were able to do that as well. And it tells you a little bit about what paid sick time may be used for, which includes individual illness and illness of family members. So let's see, the next one, please. So we'll talk a little bit now, and I'm going to bring Analilia into the conversation about how did we get here, and the role of community partners in helping us draft the legislation, engage key stakeholders, and their ongoing efforts to generate community involvement. I'm also excited to say that it became effective today, Friday, January 24th. So this is a big day for us. And and we're going to this year also engage in a study which is going to look at the impact of this law on both the health of our community members and also the impact on business. I should also say that that the support for the ordinance was tremendous. We had so many small business owners come to city council hearing and tell us, how they supported the bill, how they in fact had, to the best of their ability, adopted sick leave, paid sick leave for their employees. And so that was a tremendous thing to hear, that so many in the small business community were strongly supportive of what Jersey City was going to do. And we had the support of the mayor, the city council, and so many community members. Analilia?
So thank you. Thank you for having us here. We are very, very excited actually that today is day one. So I do want to first talk a little bit about what groups comprise the coalition that got this done in partnership with the city of Jersey City. We had, when I started this process, I was the local director at SCIU 32BJ, and then went on to actually take on the ED-ship at Working Families that had been working on this issue in New York and other cities. You may actually be familiar with initiatives that may be going on in your states. But the coalition was comprised of unions, community groups, some clergy folks, different organizations that were very, very focused on the idea that this is an issue of fairness. This is an issue of stability, economic stability for working families. We mentioned that the most vulnerable members of your community are least likely to have access to paid sick time. These are food service workers. These are child care workers. These are direct care elder care workers. These are people who, if they get sick, they're forced to go in to work sick. And that's a public health issue for yourselves, because you're talking about the people who take care of our kids, serve food, take care of our elderly, who are at the forefront of outbreaks of, keeping them at home when they're sick can prevent outbreaks of whatever. In New Jersey, we actually had an outbreak of the mumps in Belmont. The CDC recommended to those workers, food service workers actually, to stay home for 5 days if they exhibited symptoms. If you don't have access to paid sick time, you cannot stay home for 5 days. You will try to hide the fact that you were sick. You will go into work sick. You are likely to serve food, and again, serve food, take care of children, take care of the elderly, because you don't have access to this time. It's a high probability that you will make your customers or clients ill just because of need, because a week off of work means not making the mortgage payment. That means not making rent. That means not being able to buy groceries for that month, much less that week. So anyway, so this coalition was very focused on all the different impacts, economic and public health impacts that this initiative would have. We contributed, we went to the mayor very early on actually in his tenure, and we were like, we have this great idea. We've worked on it as a coalition in other cities. We're trying to get this done. We think that this would be really good for New Jersey, and honestly, as a new mayor, this is actually really good for you. So we made this commitment to him that we would we would provide him with all of the policy, not only examples of the ordinance and different sample, assisted in the writing of that ordinance in a way that made sense for the city of Jersey City. But we also made a commitment to provide him with whatever research or information he would need in order to be able to defend this position, right, or this proposal. We understand that elected officials, you can't, it's not only about coming up with a good idea and having good intentions, but it's also having the backup to move these things, right? You're going to be faced with opposition, and as much as we could provide the mayor of Jersey City information and tools and resources to fight back, we were prepared to do that. We also made a point to engage stakeholders. We made that commitment to the mayor, and we're doing this actually in the city of Newark. There's a final vote on the very same ordinance on Tuesday. So Newark is going to actually become the second city in New Jersey and the seventh city in the country to adopt this. And one of the things that we did was engage stakeholders, and that's not only the people who are supportive, but the people who you would think would be against it. There's a reason why business owners came out on these city council meetings to talk and support. We went out and we canvassed different employers, different business strips, and started asking, do you provide sick time? Have you thought about it? We actually had conversations where we helped business owners, you know, just by engaging them to realize that if they provided paid sick time because they were doing the right thing for their employees, supporting this ordinance would actually be beneficial to them because it equalized the floor, right? They wouldn't have to have this unfair competition with an employer who didn't provide this time if this went through in Jersey City. That proved to be an incentive for folks that were like, I'm doing the right thing and I'm not going to get penalized because of it. This is great. I'll go. What time is the city council meeting? Finally, we also made a point to, outside of just business owners and whatnot, we made a point to generate as much community engagement, and that is code for publicity. We understood, again, part of this process is, again, good ideas, back up to do it, and then, there's political mileage. And I'm sorry, I'm a political director, so I talk like that. Apologetic, but there's political mileage that you can gain when you do the right thing, and having partners on the ground to help laud the work that you're doing, to help put out op-eds, to help speak to reporters, to help ensure that the message isn't only coming from you, the elected official, but also from your community is really important. One example is that when the mayor went on a radio show that in New Jersey, this radio program is notorious for beating down good ideas. We made a point to have our folks dial in, listen in when the show was supposed to happen. Every single call that came through was actually positive because we were aware, we were prepared to be cheerleading section on for the mayor on this initiative, and this is in many ways, and I want to say in the many years, but it hasn't been that many years. That I've been working with elected officials. This was a great example of having an elected official actually realize that community groups aren't just, our community partners aren't just for having that one-on-one or one public meeting. We could actually be real partners in every step of this process, and we could be both, we could be helpful, we could be resources, and we could be the group that you point to and say, well, I have to listen to those folks. You see how well organized and loud they are about this. And, this is, I think, something that other cities could replicate, and we hope you do. All right.
Thank you so much. I just want to say that, from the beginning, the mayor really viewed this as a question of fundamental fairness, and at the same time, in developing, this ordinance, really balancing the needs of employees and also the needs of the small business community. And we're looking forward to its implementation and the record after the year and the evaluation of its impact. So thank you very much. I appreciate the opportunity to present.